It's great to see everyone today. There's a lot to cover today, as you can anticipate from the team that will stand alongside Secretary McDonough. So allow me to give the ground rules. To press in attendance, as always, once I open the Q&A period, please raise your hand and wait for me to recognize you. Once called upon, please step to the microphone. To those joining virtually, please remember to remain on mute for the duration of the press conference. During the Q&A, please use the raise your hand function, and a member of my team will recognize you. Once called upon, please unmute and turn on your camera to ask your question. Please remember to return to mute immediately following your question. Today, we have our top human resources executives joining the Secretary to share our hiring efforts as part of PACT Act implementation. With that, I'll now step aside and turn the floor over to Secretary McDonough.
All right, thanks, Terrence. Good afternoon, and thanks, everybody, for being here. I'll be brief, so I'll quickly turn things over to the team of professionals who will bring you up to date on one of our highest priorities at VA right now, namely hiring the people that we need to serve America's veterans as well as they have served all of us. I'll start by following up on our work housing homeless veterans. As you know, we set an ambitious goal earlier this year to place 38,000 homeless veterans into permanent housing by the end of 2022. Today, I'm pleased as of the end of September, we've housed 30,914 veterans, about 81% of our goal, well ahead of where we'd hoped we'd be right now. Now, by way of introducing our human resource experts, I'll say a few words on our push to hire and to hire quickly. This is a top priority for a variety of reasons. For one thing, hiring is particularly difficult across the healthcare sector at the moment. For another, we're driving hard on so many fronts, ending veteran homelessness, preventing veteran suicide, maximizing access to and timeliness of care, continuing to vaccinate veterans, driving down the claims backlog. The list goes on and on. And on top of all that, the PACT Act is going to help VA deliver benefits and health care for millions of toxic exposed veterans and their survivors. Already more than 100,000 vets have filed claims for these benefits. And with the promise of so many more veterans coming to VA for care under these provisions, we need aggressively to hire the people who will deliver the benefits and world-class health care vets have earned and deserve. Now, I've visited facilities in VISNs 17, 21, and 22 recently, and what I heard from our nurses was promising. They told me that hiring is on the upturn. VA had a net increase of 2,042 registered nurses during FY22, a big accomplishment during this tight market. In fact, our nurses intend to stay with VA at a higher rate than in the private sector, and nurse turnover at VA is substantially lower than in the private sector. And the nurses I spoke with this month told me, in part, it's about being on teams devoted to fighting like hell every day for those who fought like hell for us, giving them our very best. That is a privilege, it's an honor, and it's an intangible benefit no other institution offers. Now, to give you some insights on our current hiring efforts, let me introduce our human resources lineup. Ms. Gina Grosso, our Assistant Secretary for Human Resources. Ms. Jessica Bonjourni, Chief of Human Capital Management at VHA. Dr. Aaron Lee, Executive Director of the Office of Human Capital Services at VBA. And Dr. Lisa Thomas, NCA's Executive Director of Human Capital Management. Gina, Jessica, and Aaron are going to touch on a few topics: new hiring authorities and special pay incentives, and how all that works to serve veterans when it comes to services, benefits, and health care. Gina, you're the lead-off. We'll turn the podium over to you, and the floor is yours, and then we'll take some questions.
McDonough and distinguished journalists, thank you for the opportunity to share the VA's progress on implementing PACT Act Title IX workforce provisions and to share the VA's collaboration with the Office of Personnel Management on special salary rates for information technology professionals. We are grateful for all the human capital authorities that Congress included in the PACT Act legislation and the President signed into law. This legislation provides a broad range of recruiting and retention authorities that will allow the VA to recruit and retain the workforce we need to provide the care and benefits to the nation's veterans, their caregivers, and survivors. As Congress developed this legislation, the VA Human Capital team started identifying the policies, procedures, and systems required to implement the authorities that would eventually be included in the final version of the PACT Act. This proactive approach yielded the progress we have to date. Title IX includes 9 sections and various subsections that need to be codified in addition to requirements for 2 workforce plans. The first is to recruit and retain HR employees, and the second, a national rural recruitment and hiring plan. Areas that are codified or in final draft include removing restrictions on hiring housekeeping aides. In a short period of time, this new authority resulted in the highest number of housekeeping aides on board this calendar year. Increasing statutory limits on awards and bonuses by allowing up to $25,000 without OPM approval, vice the current $10,000. Increasing limits on expedited hiring of post-secondary students and college graduates from 15% to 25%. Increasing student loan repayment limits from $10,000 per year to up to $40,000 per year, and increases the lifetime limit from $60,000 to $100,000. Increasing the limit from 25% to up to 50% for recruitment, relocation, and retention incentives, and the authority to pay those retention incentives in a lump sum payment up front. We're working to publish the policy for authorities related to special salary rates, critical pay positions, and critical skills incentives by the end of the calendar year. The last authority to implement is one regarding rural health care, and that policy is on track for a March 31st, 2023 completion date. Once all the policy is complete, we will begin the challenging task to implement and oversee its use and provide transparency to Congress, who gave us all these authorities. Now I'd like to do a quick pivot to special salary rates. With the competition for cyber expertise ever growing, the VA is leading the effort within the federal government to seek OPM approval for a special salary rate to establish higher rates of pay for federal information technology management employees, with a strong focus on those at the entry levels. Other agencies partnered with us on this to include the Cybersecurity Infrastructure Security Agency, the Department of Health and Human Services, the Department of State, and the Department of Energy. We are continuing to work collaboratively with the Office of Personnel Management as this proposal is considered for government-wide application. This salary rate proposal, if adopted, would help address the severe pay gap between the federal and private sector's cyber workforce, assist VA in the recruitment and retention of cyber talent, and mitigate expected turnover and a growing need for new skill sets in the cyber arena. Thank you for sharing your time with us today and your interest in the VA's workforce.
Thanks, Gina. Talk about how the PACT Act and the RAISE Act are making VHA a more attractive place to work. I want to talk a little bit about why VHA is already an incredible place to work. Like many of my VA colleagues, I come from a veteran family, and I believe strongly in our mission. But what makes us different is that no matter what your job is, you will make a real difference in people's lives. And the way you take care of veterans and other employees, we take care of you at work and in life. I think of one of our physicians, Dr. Weeks, who told us that after being in the private sector and then being in VA, the benefits are unmatched here, and that after one day of being with veterans and being with her colleagues at the facility, she knew our workplace was special. All of that is why we were recently named one of the best places to work across the federal government. We've always worked hard with Congress and other federal partners to create the best experience for our employees. For example, the CARES Act gave us the ability to offer more competitive pay and incentives since the beginning of the pandemic. And now, the RAISE Act and the PACT Act are giving us the financial tools we need to recruit and retain the best talent that healthcare has to offer. I'll start with the RAISE Act, which increased the pay cap for registered nurses, advanced practice RNs, and physician assistants. We've already made nearly 10,000 pay adjustments since the law passed. The PACT Act also unlocks doors we've never had open before. For instance, we were able to eliminate the agency-wide caps on awards and bonuses in VA, and we can now offer recruitment, retention, and relocation incentives up to 50% of employee salaries. The PACT Act also provides a new critical skills incentive for key positions that will allow us to be more competitive with the private sector and increases special salary rate limits for some of our most in-demand jobs. We also offer a great student loan repayment program. VA can now offer employees up to $100,000 in student loan repayment over the course of their careers. And we help our workforce take advantage of the federal public service loan forgiveness program. Just in VHA, we certified loan forgiveness applications for more than 2,500 employees this month and for over 26,000 employees since the beginning of last year. Your long-term success matters to us, whether you're clinical or non-clinical. We offer medical residency and scholarship programs, tuition reimbursement, leadership training, promotional career pathways, and so many other development opportunities that no other healthcare system in the world can match. And we offer top-tier benefits and flexibility, like childcare subsidies, immediate paid time off, and even giving you options in where and how you work. It's never been a better time to work for the VA. We hired over 47,000 new staff into VHA last year, which set a new record for us, despite the incredibly tight labor market. So I'll close with a recruiting plug and invite all of you to go to our VA Careers website. That's www.vacareers.va.gov to join the best healthcare organization in the world. Thank you.
Good afternoon, everyone. My name is Dr. Aaron M. Lee, the Executive Director of VBA's Office of Human Capital Service, or as we lovingly call HCS. And I appreciate this opportunity, Mr. Secretary, to tell all of the amazing things that HCS and VBA is doing in support of PACT Act hiring efforts as we take FY23 by storm. For those unfamiliar with our mission, HCS manages the end-to-end process of the employee life cycle, providing excellent, customized services to meet each employee's unique needs. So far, our efforts have resulted in VBA hiring 97% of the 2,094 toxic exposure and military environmental exposure positions from the 2021 budget. As we carry this momentum into FY23, we're strategically bringing and proactively applying several key lessons learned into our PACT Act hiring efforts. First, we're focusing on improving the customer experience while simultaneously refining outcomes and results. HCS has developed a calendar for FY23 outlining job opportunity announcements, posting dates for veteran service representatives, commonly referred to as VSRs, and rating VSR positions that align with our VIP, virtual, and in-person progression program training. Second, we're maintaining a steady flow of eligible and available applicants for selection at predetermined timeframes by successfully piloting a system of open, continuous national announcements using our direct hiring authority. Implementing applicant reviews within 15 days has also resulted in cost savings for VBA and improved metrics in filling VIP training. Finally, we've identified hiring best practices and shared these strategies with selection officials VBA-wide, which has already produced phenomenal results. In fact, HCS recently partnered with our Nashville regional office and the Department of Defense to host a resoundingly successful VBA hiring event at Fort Campbell Military Base, Kentucky, in support of the PACT Act. HCS spearheaded a streamlined process that included conducting interviews, fingerprinting, and equip initiation, resulting in 61 job offers in less than 1 day, as well as positive feedback on our efficiency and effectiveness in hiring qualified candidates. We remain committed to supporting PACT Act hiring efforts to help with disability claims processing, improving customer experience, and providing VBA employees with consistent, reliable, and timely HR support and expertise through our mission of building strategic partnerships through service. Thank you so much for your time today.
Thank you, ladies and gentlemen. And with that, we'll open the floor up to questions. Leo.
Yeah, thanks so much for doing this. You mentioned the 10,000 pay adjustments you've made and some of the other provisions of the PACT Act that are geared towards retention. Do you have any numbers right now to say how effective that is? Do you have any results in terms of folks who usually would leave who are staying, or any sort of metric there?
Sure, thank you for the question. I believe the 10,000 you're referencing was related to the RAISE Act, adjustments we've made there. We don't have data yet. We've just gone through the process of getting those payments out, but we will be tracking that closely. Usually we look at retention information over the course of a year or more, so we'll be happy to provide that to you after some time has passed.
So it'll take a little while before we can really see that.
Absolutely.
And I guess, Mr. Secretary, more broadly with all of these changes to hiring and this focus on hiring, a lot of this is geared towards a longer-term look. Are you still confident that you're going to have enough people in place at the start of next year to deal with when the benefits and when the people start coming in for the PACT Act?
Yeah, thanks very much, Leo. Let me just, I want to remind you too what I said in my remarks about retention. As a general matter, our retention rates, for example, if you take nurses, are basically 3 times more effective than in the private sector. So we feel quite good about that in the first instance for the reasons that I think Jessica laid out very compellingly in the opening of her comments. These additional authorities will allow us to be that much more competitive in retention. I do remain confident, Leo, that we will have the personnel in place to continue to meet the demand, the increased demand that we're seeing in terms of claims filed at VBA. We're up, last time we talked, we were up about 21% in the number of claims year on year. Right now, we're up about, I was told this morning, at 19% year on year. We're processing as many as 7,500, as high as 7,900 claims a day, which is a new normal, a new floor for us. It used to be that getting over 7,000 claims filed a day, processed a day, was a good day. Now we have a much greater expectation, partly because of what Aaron explained to us about the increased number of personnel at VBA. Nevertheless, notwithstanding the fact that we're processing many more claims a day, we're also getting many more claims a day, as many as 1,000 more a day. So that underscores the importance of your question and underscores the importance of ongoing training and onboarding efforts at VBA. 1, 2, at VHA, we continue to have a little bit more time before the eligibility kicks in. Nevertheless, we have hiring needs across the system that stretch back to a range of issues, to include the general challenges with hiring in healthcare as a result of the pandemic. Notwithstanding those concerns, though, I remain confident that we will have the people in place to make sure that we meet the demands from vets who have waited too long, in our view, to get access to the benefits and care that they've earned here.
Okay, and related to that, the first-time claims backlog, I know it has continued to go down a little less speedy than we saw earlier this year. Are you still confident that that's on the right path with what is going to be another spike coming in January?
Yeah, so let me, I'll give you a couple of data points. Disability claims backlog as of today, 144,000. 144,021 backlog claims. That's down 45.5% since the recent high in October. 1. 2, the percentage of claims that are backlogged is also low. It's at about 22%, which is an historically low number, a historically low percentage of the overall inventory of claims at VBA. But that makes the point that you and I were just discussing, which is we are seeing the inventory of claims go up commensurate with the demand from the PACT Act. So much so that total rating-related claims received since August 10th, when the president signed that bill into law, are 429,000. Of that, the total PACT Act claims are 112,949. So that gives you a sense of what we're talking about. Backlog coming down, thanks to Aaron and those great claims reviewers that we have, VSRs and RVSRs. But overall inventory continuing to increase because finally vets who have served throughout Southwest Asia since the first Gulf War are finally getting access to claims. And we just urge all those vets watching, VSOs, working with your members, please visit us at va.gov/PACT or call us at 1-800-MyVA411 so we can get your claim filed.
Great, thank you.
Thank you.
Sarah, good afternoon.
Good afternoon, Sarah Samore from Stars and Stripes. I wanted to know more about the toxic screening. I believe it's supposed to begin November 8th. How will that be conducted? And what do veterans and families need to do when the day comes to get screened for toxins?
Okay. So we talked a little bit about this last week. We ran the pilot at 7 different sites, and we've seen just over 15,000 vets. We're now honing that process. As you say, as of November 8th, getting that toxic exposure screening, that is now will be available as of November 8th for all veterans currently enrolled. So the way that they can get that screening takes about 5 minutes. Is that they can work with their primary care provider at their CBOC or at their VAMC. And everybody's going to be by then trained up, ready to execute that process. So the best thing for vets to do is to be in touch with their primary care provider to make sure that they're getting in to be seen. And in the process of being seen, they can make sure that they get this toxic exposure screening, which, as I said, is about a 5-minute process. And the pilot demonstrated that as many as almost 40% of those vets screened actually believed that they had been exposed to different toxins at some time. So it ends up really increasing our own visibility into the exposure that our vets have experienced, including vets who are already in our care. Does that help?
So you mentioned 5 minutes. I take it as a questionnaire. Like, I mean, there's also, like, I guess.
Yeah. So I think what we might, maybe what the best thing to do here is let's make sure that we get you the transcript of Dr. Elnahal's explanation of this kind of soup to nuts, so that you can have that for your reporting.
All right, thank you.
And Terrence can work with you to get that too.
Thank you.
Okay. Thanks.
We have Patricia Kime online right now. Good afternoon, Patricia.
Hi, thanks for doing this. Appreciate it. Patricia with military.com. Today in the JAMA Network Open, there was a report about the racial disparities in COVID treatment in VA hospitals, namely saying that Black veterans didn't receive advanced medications at the same rates as white veterans. And I'm wondering if the Secretary would like to comment on that and talk about some of the efforts that VA is doing to address health inequities in VA medical centers.
Yeah, Patricia, thanks so much for the question. I'm sorry that I didn't see the report, so I will get that afterwards, and we'll make sure that we get you concrete comment about the report. As we've discussed in this room many times, obviously ensuring equitable access to the care that our veterans have earned is a fundamental priority of President Biden's. And we've taken a range of steps to ensure that that continues to be the case. The thing I don't understand about the question that you asked, Patricia, is access to advanced medications. I guess that means access to treatment options once COVID positive. But let me dig into that. But two things I think are important to keep in mind is access to vaccine for veterans of color in VA relative to access to vaccine for civilians of color in the United States. VA far outperformed those numbers, partially because of our concerted effort to make sure that any veteran who wanted access to vaccine received that vaccine. Moreover, our effort, which is unique in the federal government, and our pilot of test to treat, which allowed us to make sure that we could get Paxlovid treatment quickly to vets who test positive through, within the 5-day window, and through, for example, our mail order pharmacies, also demonstrated good performance across the board on equity. Nevertheless, I think it's a fair question. Let me dig into the JAMA article, and I'll make sure that we get back to you through Terrence.
Thank you. Can I ask a follow-up to Sarah's question?
You can
Is
ask
there a
us
way we
whatever
can get
questions you want.
a copy of that, the screening questions for the exposure screening questions?
I missed the first part of it. What about the questions?
I was wondering if we could actually get a copy of those questions.
You know what, I don't, it seems like a reasonable question. I don't want to make a promise, but let me have Terrence follow up with you. I'm sure that's fine, but let me have Terrence follow up with you.
Thank you, sir.
Yeah.
Eric.
Eric Katz with Government Executive. Just to follow up quickly on Leo's question, the 10,000 nurses who have gotten higher pay, was that something that happened automatically, or did that just showed up in their paycheck, or did they have to do some sort of proactive steps for that?
Hi, Eric. Nice to meet you in person. It was not, they didn't have to do anything. So we took an approach with the implementation of the RAISE Act that any nurse that was on a pay schedule that was already at the cap that was previously in law automatically had an adjustment to their pay. And then we went back through and looked at any nurse that was within 10% of that cap, evaluated the market conditions, and made appropriate adjustments. So individuals didn't have to do anything. Those were actions processed in the back end by HR.
Got it. And then I just wanted...
They're all dated to a specific period, is that not right?
Yep, they're dated, they were backdated, so there was some processing work to make sure that they got there, yep.
Okay. And then in the initial comments, there was a lot of discussion of the various PACT Act, and I think it was mostly PACT Act provisions that are being implemented, and I think there was rulemaking that you were discussing. Could you go through that with a little bit more specificity of where we are with each of those? Is anything being implemented already, or is it still needs to be rolled out? What's the timing look like? I know you mentioned end of calendar year for a couple of them, but if you could go through that, I'd appreciate it.
Yeah, sure. So Congress gave us a lot of authorities, but until we write the policy on how to use it, we can't be effective. So we're about halfway there with the policy in the field, and the rest of it, with the exception of one, will be by the end of this fiscal year, we're projecting, and then that one on rural health will be in the first quarter of 2023. And so now that the policy piece is out, these folks that execute have the rule set they need in compliance with the law. And then it's our job to just do oversight and report to Congress how we're using those authorities.
So when you say halfway through, meaning half of those policies are already ready to be
Yes, sir, they are out in the field, exactly.
Okay, but they haven't actually been utilized yet in terms of providing bigger bonuses, or
once the policy's out, we can start using it.
Okay.
I don't have the data yet on. I mean, these all are very, very recent. Okay. It's really 2-3 months since it was approved. Mm-hmm. So, but once they're published, we can start using them.
All right.
And
great.
Just maybe explain that you basically give the guidance to the field, but then the field is the one who uses it, right? And so the point is that the new authorities are now policy. Those policies are in the field with all the people who work for these three, so they then make those policies actual, into actual manifestation of increased bonuses or increased pay. So as Gina said, we're halfway through those policies. And, you know, God willing, we're going to see outcomes that relate to retaining professionals, recruiting new ones, and most importantly, increased access and improved health outcomes for our vets.
Thank you very much.
I will turn to Ellen. Good afternoon, Ellen.
Bless you.
Thank you so much for doing this. The Burn Pit Registry has been strongly criticized by NASM. And last week, Dr. Elna Hall said that they do need to change that. Do y'all have any intention with the toxic screening of almost automatically enrolling veterans who self-identify as having been exposed to a burn pit but have not yet registered for the registry? Can the PCP just automatically enroll them in the registry or encourage that?
Yeah, so you're right that NASM was quite hard-hitting in its reaction in its study of the burn pit registry. This follows, by the way, a very tough IG report on the burn pit registry. All of that is really important fodder for us to get this right. And so I think, let me answer your question in the following way, Ellen, which is partially, as Dr. Elnahal talked about last month when he's here, and then talked about again last week when he did his roundtable, we're trying to tighten that distance between the toxic exposure screening and a warm handoff to a VBA representative and more targeted treatment within VHA. So the shorter answer is we remain hopeful that these additional tools given to us by Congress allow us to do that. Notice I'm not necessarily saying that maybe the best answer is to refer somebody to the registry. There may be a more effective way, and I think Dr. Elnahal and his team are looking very closely at how we can make it more effective to shorten that distance between identification of exposure and specialized treatment where necessary, and in all cases, prompt review of and awarding of claims at VBA where those are earned and deserved. So the bottom line is I think NASM and the IG have given us a lot to think about here. I will say that we have a bunch of vets that we work with, and I will say that their anecdotal experience comports with the findings of the IG and NASM. And so we want to get this right. We will get this right. I think we now have the tools to get it right.
Thank you. And if I could ask a second question on a slightly different topic. Y'all mentioned that you've approved quite a few loan forgivenesses, I assume, under the Public Service Student Loan Forgiveness Program. Does the VA do anything to proactively encourage its people to apply for those, or do you just wait for the employees to come forward with their application?
Thank you for that question. Yes, you're correct. We are talking about the Public Service Loan Forgiveness Program that is currently has a temporary authority that expires on Monday. And so we have been very actively marketing that to our workforce. So we've been putting out communications and bulletins, hosting webinars, making sure that our employees get as much information as they can about how it works. We've also been training our HR staff to make sure they know how to do the appropriate processing on the back end to get the completed applications done. And so the numbers I mentioned earlier were VHA numbers, 2,500 in the last month and 26,000 since the start of the year. It's a great tool. Everybody, go apply for it if you haven't. Expires Monday.
That's what I was going to say. Let's do another plug. We've all been communicating with the workforce, Ellen, on this. This is like a great tool. So among the benefits of this new look at the public service loan forgiveness program that Jessica talked about is a recognition that, for example, time on active duty is public service. And that is something, obviously, that factors in quite a bit for many of our employees, themselves veterans. So those of you who are watching, who have not yet been in touch with any of the HR teams about this, please reach us quick, fast, and in a hurry, because this temporary authority expires on Monday, on October 31st.
Thank you, Ellen. We'll turn to Sarah. Good afternoon, Sarah.
Hey, Terrence. Thank you all for doing this. So a few times you mentioned some of the cyber workforce shortages, the special salary that you are working with OPM on. Once you have employees in or have hired them, do you have any specific training programs you're offering to get them ready for the evolving cyber landscape?
So I'm not an expert, but I do know that we're working hard to get entry-level employees in, but really until we fix the pay disparity, we just can't attract that talent. And so that's really what we're trying to do with the special salary rate. And OPM has been wonderful to work with. So yes, we will have training programs because we're trying to get young people in and we're trying to keep them. And I can certainly get you the people that are expert at this to give you more detail.
Yeah, that would be great. Do you have any updates on the special salary, when you expect to see a return on that?
We are expecting to hear something in December or early January.
Great. Thank you so much. Thanks.
Thank you, Sarah. We'll go to Jory. Good afternoon, Jory.
Good afternoon, Terrence, and thanks everyone for doing this. Another question on the hiring piece of things, specifically the onboarding piece of things. I know that Dr. Elna Hall recently said that the VA is going to have an onboard surge event soon to bring people online, people who have accepted a job offer and are still waiting to be brought on board. I'm just curious, that kind of seems like a one-off. Is there a more holistic solution that VA is looking at in terms of addressing that onboarding time, which can be, I guess, pretty long sometimes?
Yes, thanks for that question. This question is usually directed at VHA because we have extensive hiring timelines, especially for our clinical professionals. So yes, in addition to the work that we're doing for the onboarding surge events, which are the week of November 14th, where every facility in the VA with a couple of in the VHA, with a couple of exceptions, will be holding some type of onboarding surge event with a culminating event happening on that Friday, the 18th, where we'll bring together human resources and facility leaders to work through lessons learned and celebrate the successes of that process. It's not just a one-off event. That is one event that we are hosting on the same week, but facilities hold these types of events all the time in addition to hiring fairs. As well as that, we are, as was mentioned, focusing on our top priority to make sure that we recruit more swiftly and more effectively. We are leading up a Tiger team right now to design some new interventions around improving the steps in the onboarding process. As I'm sure you're aware, for our clinical providers, there are more steps than we might need to take for a non-clinical workforce. So we are focusing our process engineers on looking at the steps in that process to find things that we can eliminate. Many of them are bigger policy issues that we here at Central Office are working to update, like modifying steps in our processes that have handbooks and policies that need to be changed, looking at, do all the positions that we have right now need to take a physical Probably not. So we had to take a look at that and cut out a whole bunch of positions, just cut out steps in the process all throughout. So we are well on our way to doing that, and we'll be happy to provide you an update on that as we progress.
Okay, great. And I know that OPM for a while at least had some emergency hiring initiative or hiring authorities to bring people on board more quickly. Have those expired at this point, or what's the current state of those?
I'm sorry, we didn't catch the question. I was actually going to respond to your first question, so if you could ask your second question right after my response, I think that'll be helpful. So I just wanted to echo what Ms. Bongiorni said. Not only are our onboarding events not just one-offs, but we're also, and I mentioned earlier, we've done some recent job fairs on site at military installations, and we're finding that that's becoming one of our really successful ways of grabbing not only veterans, but also military spouses. And so being able to increase that particular subset of candidate is really useful, especially for some of our positions that are portable. And so what we're finding in the onboarding process is we're able to really cut that process down, doing 99% of that work in person on site. So as I mentioned earlier, we were able to hire over 61 people in less than 24 hours. So when you think about the onboarding process, that's net zero for us. And so it's a really big win. And so it's something that we're continuing to join with our colleagues in VHA. We've been talking about other joint events so that way we can share in that particular aspect of cutting that particular onboarding time down. We know that with respect to onboarding, when we look at our colleagues in the private industry, they're able to hire a lot faster. So we've also been working with Ms. Grosso's team and talking with OPM about what other ways can we cut some of the fat out of that onboarding process so that we can continue to be competitive employers. It's one thing to be an employer of choice. It's another thing to be an employer that can hire you quickly. And so we want to make sure that we're blending the two.
And your second question, Jory?
Yeah, my second question. Sorry for cutting you off
Yeah, no
earlier.
worries.
I know that OPM, for a while at least, had some pandemic era authorities in place allowing VA to bring on people, do that onboarding quicker. Just what's the current state of those authorities? Have they expired at this point? Are they still in play in limited circumstances? Just help me better understand what the current state is there.
So I can speak to one in particular. Direct hiring authority is one that we're utilizing very frequently. It's one of the major successes for our speed to hire. And so that authority was supposed to expire, but OPM has extended that for us. And so we have that until next summer. And so we're also looking to see if there's some opportunities to continue to increase the ability to use that because it does drastically cut down that particular time period of our time to hire model. So that's one particular authority we're really excited about. And so if any of our friends in OPM are listening, we are looking forward to keeping that particular option.
Okay, thanks so much.
Thanks, Jory. Appreciate you. Sarah?
Hello again, Sarah Smart, Stars and Stripes. I just wanted to ask about, you mentioned about loan forgiveness and help repayment up to $100,000. Now, for VA employees who want to get that loan forgiveness or have that, I guess, will they have to sign a contract to make, and they have to stay like a year or 3 years, or will they have to pay if they decide 6 months later, you know what, I'm gonna go to another private institution?
Well, we talked about a couple of different programs today. So the Public Service Loan Forgiveness Program is one that applies to people who already have 10 years of service. So they've completed their service already by the time they go through that, so there's no additional commitment. For the Student Loan Repayment Program, it does require a service commitment of 3 years. So yes, we do expect people to stay on with us. And that's one of the great tools that we have. We have another program in VHA, the Education Debt Reduction Program, which allows us to pay for the student loans of people in clinical positions primarily. It's also paid in arrears, so they've already completed their service when they receive it, but we find it to be a great tool for both recruitment and retention.
And so if they leave 1 year later, then they would have to pay back? Or
it
wouldn't be paid until after 3 years? I want to make sure I understand.
Varies by the program. So for the Student Loan Repayment Program, if someone received that and didn't complete their service agreement, then yes, they would be obligated to pay back the amount that the agency paid on their behalf.
All right, thank you.
Leo?
Mr. Secretary, I wanted to ask you about the abortion policy. A couple of lawmakers and veterans groups last week urged VA to go even further than what you've already stated. I know you're still going through the rules review process. Is there any change, any alterations you see as you're going through that process, or any opportunity to broaden out the rules at all?
Thanks. Good question, Leo. Before I answer it, I want to go back and just highlight, in light of what Aaron said, the good work of Cheryl Mason, the former chairman of the Board of Veterans Appeals, who is recognized as an administration-wide leader on the effort to hire military spouses. And I just want to say on the record here how grateful I am for Cheryl's work on this, and make sure that you're all aware of how uniformly admired she is across the administration for her work in that field. One. Two, I've obviously watched the public debate quite a bit on the interim final rule. As you know, we're in the process, as you've just said, Leo, of reviewing the several tens of thousands of comments that we've received. So I have to be quite careful about what I say about it in light of the requirements of the Administrative Procedures Act. But what I can say is that, and I guess this goes in direct response to your first question, we did this because we believe that veteran patient safety, which is the overriding principle at VA, demanded that we do it. And so we will continue to consider it in light of that, and additional comments that come in or additional ideas that come in, we'll consider those in light of that very important principle. And so I don't have any news to make in terms of potential alterations or any updates or anything on that. We're busily working through these many comments that we've gotten. We're also making sure that our teams are well prepared and well trained to make sure that we can provide this critical service, which in certain instances is obviously critical to veteran patient safety, and that has been, is now, and will continue to be the principle on which we implement this policy.
Given the amount of response you've gotten, do you know what the timeline is for getting that done?
I don't. I know that the team's working very aggressively to work through those, but we also want to give the comments the care that they deserve. It's obviously an important set of policies about which there's a lot of expertise and a lot of understanding and a lot of views, and we're going to give those views careful consideration.
Great, thank you.
Thank you.
Eric.
Sorry, just another follow-up on some of these new hiring and incentive authorities that you have. With all these new things, some of them are obvious how they're going to be felt by applicants. If you're offering more money, that's obvious that you're what the benefit of that is. Some of them are a little bit more beneath the surface. Is there a strategy in terms of making sure that applicants or potential applicants are aware of these changes, and that that they know that there's potential for example, getting student loans repaid or things of that nature?
So you see, we're all excited to talk about this. We couldn't decide who should say something. But so one of the best ways that we do is to market all of our particular opportunities. I think you heard Ms. Bongiorni direct you to vacareers.gov. That's actually a VHA site that we all share. So we put all of our information at a particular location. Our most recent job fair that I keep talking about at Fort Campbell, which was so successful, a lot of those people saw our announcement and all of the benefits that we're offering on that particular website. So that's one way we do that. We are masters of sharing our information through social media sites, through VA's multiple platforms, but also through LinkedIn and any of those particular job locations where we know candidates typically will find that information. The other thing that we do is we partner with a lot of our VSOs, and so they help to market this in ways that we just can't even imagine. I mean, they're not only being able to market it to veterans who are coming in, but also the family members and those who might be military spouses or children who have access to some of the same benefits. And then lastly, I think one of the best ways that we do this is getting out the information at our local stations, because we still have foot traffic in a lot of our facilities where people are coming, and they'll see all that information that's available to them. One of the authorities that we have for post-secondary education and being able to bring in recently graduated students, we recently started to put a blitz at all of our universities, at all of our 56 regional offices, and I'm sure in the medical centers as well. So all of those students have awareness not only of the benefit of the job, but the benefit of coming to us. It's a new day today. When I started in this role over 20 years ago, and as I was excited about an internship program, there was no funding for me to come, and I just came because of the mission. And now we're able to offer so much on top of the mission. So we're really excited about the opportunity for all of the students, all of the candidates to hear about that. So if you aren't seeing our information, then we want to know where you're looking so that we can make sure that we're putting that information in those spaces.
Thank you.
Thank you.
You know, I think this is an imperfect. This is an imperfect analytic tool, but I'm routinely surprised on the upside at the number of applicants per open position. And so I don't know if you guys have data on that. I could say some from memory, but chances are they'd be wrong, and then Terrence would have to fix it. So I don't know if you guys, is that a useful measurement? Am I right to remember from briefings in the last weeks or so that we are actually seeing an increase in applicants per opening?
So for our particular positions that are posted in our claims processor positions, which are typically posted in a way that I don't think would necessarily be automatically attractive to people, we found new ways to start marketing those so people understand what the real function of the job is and the connection back to the veteran. So what we've found since transitioning our new marketing program to really being more plain language and using information that we know that is translatable and transferable skills for those in the marketplace, we've seen a drastic increase in our applicant rate. So before PACT Act, we would typically get hundreds of applicants for these positions. Now within PACT Act, we are getting on average between 3,000 to 5,000 applicants per job announcement. So it's a great problem to have. It obviously adds a little bit time into sorting through the resumes and making sure we're picking the most qualified applicants, but I'd much rather have that challenge than for us not to have enough candidates. So the candidate pool is very wide. And now that we're offering more flexibilities and other job retention and recruitment bonuses, we're seeing that increase even more. So we're excited about the particular opportunity because we're noticing that every announcement we put out, there's more and more applicants coming. And so I'm thinking, and in my foresight, I feel like once we even go further and start to reach more of our installation sites, we're gonna see even more of those transitioning servicing members who are now looking for positions, especially those who are traveling with a spouse who are looking for a position that's portable. So we'll have that opportunity to not only just hire one veteran, but also a spouse or a partner. So we're seeing kind of 2- and 3-fold being able to hire people, and so we're looking at that and dicing out that data, but it is definitely an influx of applicants and definitely a great problem we are excited to have.
Yes, sir.
So based off what you just said, are you modernizing your HR systems so you don't have to manually go through 3,000 to 5,000 applications per position?
Great question. So I would say that we're modernizing as much as humanly possible. Ms. Grosso's team is working really hard with OPM on the systems that we currently have to see if we can do some other things to automate the process. We're now looking at assessment tools, and so the assessment tools will help applicants cut down the time of having to go through a laborious interview or multi-interview process. So we're able to cut down to that best qualified list a lot faster, and then our hiring managers have an easier time of making those particular selections. So that's on the horizon. We're really excited. My office has already piloted that for VA, and so we can't wait to start diving into that particular era. So that's one of the best ways we've been able to do that, and I know that OPM, in partnership with other federal agencies, are looking at more of those ways to automate the process.
That's great to hear. Good luck.
Thank you. Ellen, you have a follow-up?
Yes, thank you. Sorry about that. You talked about hiring benefits and claims processors. On the clinical side, what are you seeing as far as number of applicants for things like social workers? And, you know, you already talked about nurses, but, you know, not necessarily physicians, but other kinds of providers than, you know, just the physicians and the nurses.
So we are also seeing solid trends in our applicant data for clinical providers. We continue to see increasing interest going to our VA Careers website, as was mentioned. I would say the place where we have still some challenges is in the very entry-level positions, wage grade occupations, because the market is still pretty tight for entry-level positions. That's why we're really excited to have the authorities we have under PACT for housekeeping aides, because it's going to open up the applicant pool and let us reach more potential candidates in the hiring process. So we will be monitoring that closely. We did see trends going in the wrong direction there for a while, and they're starting to turn around now.
Thank you so much.
Any further questions? Awesome. I think so, sir. You know, I know our next one is scheduled in I think December 1st, sir, but so I'll be remiss to not say Happy Veterans Day to all the veterans out there. We won't see you until next month, but thank you for your service, and we look forward to seeing you all next month. Thank you again. Thank you, team. Appreciate you.
Thanks, everybody. Good job, guys.